Welcome back. A woman's body goes through many changes during her pregnancy, but did you know that women can actually develop diabetes during this time, even if they didn't have diabetes before they were pregnant? This common condition is called gestational diabetes.
That's right. And joining us today with more information is Jamie Jadid with the High Risk Pregnancy Center. How are you, Jamie?
I'm great, thank you.
Good morning.
So let's talk about this, the difference between gestational diabetes and other types of diabetes. What's the difference?
Yes, well, gestational diabetes only occurs in pregnancy. It happens in the latter part of pregnancy. It's influenced by the hormones from the placenta, and it's diagnosed after 24 weeks of pregnancy. The American Diabetes Association recommends that every pregnant woman get screened for diabetes. They drink a sugary drink, and they test their blood sugar when they're fasting, an hour later and 2 hours later, to see if they can make enough insulin to keep their blood sugar in a normal range. Yeah. The other types of diabetes, type 1 and type 2, exist before pregnancy, and they don't go away after pregnancy, where typically gestational diabetes does go away after pregnancy. Okay. So type 1 used to be called juvenile diabetes, type 2 used to be called adult onset, but it's becoming more common in young people too.
And what are some of the risks or side effects of gestational diabetes?
Okay, so what we worry about the most with the fetus is that the high blood sugar from the mom crosses the placenta and makes the baby's blood sugar high. The baby's high blood sugar then makes the baby grow too big. The baby stores that extra sugar as fat. So the bigger the baby gets, the higher the risk the baby gets injured in delivery.
And then once the baby's delivered, would that baby become diabetic too, or no?
They have a higher risk of becoming, well, and we'll get to that later, but yeah, they do have a higher risk of becoming diabetics or overweight when they are young adults. So, but after they're born, immediately after they're born, we worry about a higher risk of the baby getting low blood sugar after it's born. There's also a higher chance they'll be born early, have breathing problems, jaundice, and there is a higher risk of stillborn associated with diabetes in pregnancy.
How then do you treat diabetes in pregnancy?
So, gestational diabetics are very successful usually in just changing their diet. So if they come to our center, we talk to them about how to eat a healthy diet to provide adequate nutrition for their baby, as well as eating moderate amounts of carbohydrates, healthy proteins, and healthy fats. And a lot of people are successful just changing their diet. Then we give them a glucometer. We ask them to check their blood sugar 4 times a day. And if their blood sugars are still high after changing their diet, then we add medicine. And the most common medicine is insulin. For women who have pre-existing diabetes, they almost always require medication, but then they also should eat a healthy diet.
And which is why it's so important to go see your doctor, to get tested for it, to learn some information.
Yes, yeah, very important to make sure that your blood sugars are controlled prior to pregnancy and during pregnancy.
So let's talk about the High Risk Pregnancy Center and how they can help.
So, when you come to our center, like I said, we talk to you about diet and testing your blood sugar. When we intervene and hopefully prevent those babies from getting too big, you can see that as we talked about, the long-term risks of pregnancy or high blood sugar in pregnancy, those babies get too big, and there's this concept of fetal programming. So babies who grow too big as a fetus are more likely to become overweight or obese when they're young adults. Wow. So you can see how that could become a really unhealthy spiral. They become diabetics when they're young adults. They have bigger babies. Those babies grow up to be unhealthy adults. So when we intervene, hopefully we prevent those babies from growing big, set them up to be healthier young adults, set them up to have healthier babies, and so on. So it's a great opportunity to really make an impact long term.
And if you're showing women how to take care of their bodies, what to eat, when they're done with the pregnancy, they can incorporate these lifestyle changes into their everyday routine as well, and hopefully delay type 2 diabetes.
Right, and diabetic eating is just healthy eating. Everybody should eat a good, moderate amounts of carbohydrates, healthy proteins, healthy fats, incorporate exercise as part of their lifestyle.
No question. Now, let's talk about gestational diabetes and the effect it might have on the mother. Is there any long-term effects that could?
So women who have gestational diabetes have about a 50% chance of becoming a type 2 diabetic in the future. So that ranges anywhere from 20 to 70% 100%, but average 50% of becoming a diabetic in the next 5 to 10 years. So a lot of that is impacted by lifestyle. If they eat healthy, they exercise, they keep their weight in a normal weight range, they can decrease their chance of becoming a type 2 diabetic.
So that is the good news in all of this. It can be changed.
Yes, yes.
And if not, then are there medicines also?
Yes, the most common medicine that we use in pregnancy, like I mentioned, is insulin. When women aren't pregnant, there's lots of medications they can use. And some of those are okay in pregnancy, some of them aren't. But very important to control your blood sugar if you have diabetes prior to pregnancy and prior to conceiving.
And important to head it off at the pass and make sure you catch it early.
Yes.
It's a pleasure. Thank you so much for joining us.
Thank you for having me.
All right, the High Risk Pregnancy Center has 2 locations in Las Vegas, one in Henderson as well. And if you want to learn more about them, you can go to hrpregnancy.com or call the number on your screen. They're also on Facebook.
Next on